A hearty welcome to one and all. Today in this presentation we are going to discuss about the female reproductive toxicity. This presentation includes introduction, a brief introduction about the female reproductive system, definition of reproductive toxicity, aims of reproductive toxicity, the basic reproduction cycle, drugs having adverse effect on different stages of the cycle, that is the reproductive cycle, and the study design. Introduction. Initially, let's start with the anatomy of the female reproductive system. In the bottom here, we have the vagina, where it is a fibrin muscular tubular organ. Coming next, we have the uterus, and it is a large conical organ in the center. Each side of the uterus, in each side of the uterus, there lies two ovaries. This is one ovary and this is another. These are the female gonads. They produce eggs for the subsequent fertilization and sex hormone, which regulates the release of these eggs into the uterus. And they also regulates the menstrual cycle. Followed by this ovaries, we have a tube, and this tube is called the fallopian tube. The fallopian tube acts as a pathway which carries the egg. This is the egg, it's mentioned here. It is the egg, and the fallopian tube acts like a pathway which carries this eggs from the ovary to the uterus. Next, this is a very thick membrane which covers the uterine cavity. This is the uterine cavity, and this thick membrane is known as myometrium. It contracts during childbirth. When a child is birth, that is during the labor or delivery, what happens? This myometrium contracts in it orders to expel the baby out from the uterine cavity. And the inner line, next comes up the inner line of the uterine cavity, that is called the endometrium. And this endometrium provides a surface for the implementation of the eggs, which will be nourished by the endometrium until the development of the placenta. Next, this endometrium also acts as a soft tissue which slops off and gets removed during the menstrual cycle. So overall, this is the anatomy of the female reproductive system. Let's come to the next point, which is the definition of reproductive toxicity. What is reproductive toxicity? When the term reproductive toxicity comes, we have to be sure what is reproduction. The reproduction is usually a biological process by which new individual organisms, that is the offsprings, are produced from the parents. Now, what is reproductive toxicity? We have learned what is reproduction. What is reproductive toxicity? Reproductive toxicity is a hazard associated with chemical substances which interfere in some way with the normal reproduction. That is, these are some substances which will interfere the normal process of reproduction. And these substances may be anything like chemicals, drugs, or radiations, etc. And these substances are known as reprotoxic. Reprotoxic. They may adversely affect the sexual function and fertility in adult males and females, as well as causing developmental toxicity in the offspring. It means that due to reproductive toxicity, sexual function may be hampered, and also the fertility in adults, male and females, may be hampered. Also, it may cause some developmental toxicity in the offspring. Moving on, next is aim of reproductive toxicology studies. What is the aim of studying these processes? So the aim of this study is to reveal any effect of one or more active substances on the mammalian reproduction. That is, by this study, one can reveal whether one substance or more than one substance may have any effect, that is, it may interfere with the normal reproductive cycle. What effects it produces on the normal reproductive cycle. For this purpose, Both the investigation and interpretation of the results should be related to all the pharmacological and toxicological data available to determine whether there is any potential risk in the pregnancy or in the reproduction, and the result should be determined how much is the risk, what is the risk produced by those reprotoxic substances that imposes upon the reproduction of the human. And the study conducted should allow the exposure of mature adults and all stages of development to sexual maturity. Next, let's learn about the basic reproduction cycle. So usually this is the basic reproduction cycle starting from the sexual maturity. The sexual maturity is the capability of an organism to reproduce. The capacity of an organism to reproduce. And in human, puberty encompasses the process of sexual maturity. That is, in case of human, we consider puberty as the time of sexual maturity. Next, we have the gamete release. This is the gamete release phase. Here, production of female and male gametes and their fertilization is very necessary in reproduction. In females, gametes are produced in the ovary, and in case of male, testes are the sites for the production of gametes. Next, we have the fertilization. Human fertilization is the union of human egg, that is the female gamete, and the sperm. It occurs in the fallopian tube, and the region in which the fertilization occurs is called ampulla. The result of this fertilization is the zygote, which initiates the prenatal development. Next is the zygote transport. What is zygote transport? After the fertilization occurs the zygote production, and the produced zygote is transferred to the uterus by a series of closely associated mechanical events where activities of cilia and smooth muscles are predominated. That is, after the fertilization, when a zygote is formed, this zygote is being transferred to the uterine cavity by a series of mechanical events. This is the zygote transport. Implantation. In humans, implantation, this is the implantation process. In humans, implantation is the stage of pregnancy at which the embryo adheres to the uterine cavity. At this stage of prenatal development, the cell that is formed is known as blastocyst. It is by this addition that the embryo receives oxygen and nutrients from the mother to be able to grow. Next, we have the embryogenesis. It is the process by which the embryo forms and developed. That is, the development of the embryo is known as embryogenesis in short. Next comes the fetal development. Once the fetus is formed, the developmental process of the fetus occurs, which includes the development of the embryo and of the fetus during the whole gestation period. Parturition. After the fetal development, we have the parturition. Is also known as labor or delivery. It is a process of delivering the infant, delivering the baby and the placenta from the uterus through the vagina to the outside world. Lactation and postnatal development. Lactation describes the secretion of milk from the mammary gland and the period of time that a mother lactates to feed her young ones. Next is the growth and development. That is the growth and development of the newborn or the infant. This reproduction cycle can be further break down into pre-mating to conception, that is before the mating, before fertilization, to the conception, that is after fertilization, conception to implantation, after fertilization to the implantation of the zygote in the uterine cavity, implantation and organ formation, implantation of the zygote in the uterine cavity to the organogenesis, that is formation of the organ formation to the end of the pregnancy. It is from the formation of formation of the organ to the end of the pregnancy. Birth to weaning. Weaning is the process, is the period where the breastfeeding is generally supplemented with other food in infants. Next, from weaning to sexual maturity of that child or of that newborn. Here comes the drugs having adverse effect of different stages of the cycle, that is the reproductive cycle. In the pre-mating to conception phase, that is from before the fertilization to the conception phase, Gossipol, which is an anti-malarial drug, it induces fertilization disruption. Caffeine induces normal sperm motility, that is abnormal sperm motility is being induced by caffeine. Alcohol effects on libido. Libido, that is the sexual desire. Alcohol will decrease the sexual desire. Then steroids hormones will disrupt the egg release. Next comes the implantation. Implantation is being interfered or hampered by diethylstilbestrol. It is a hormone. It is a synthetic estrogen. Next, antihistamine also shows interfering effect in implantation process. Next, we have the fetal development. Abnormal fetal growth and development is induced by alcohol. Abnormal fetal neurobehavioral development is induced by heroin and cocaine. Next, we have fetal malformation. Thalidomide, an antiemetic drug, will show fetal malformation. Gossipol, an antimalarial drug, will show the same effect. DES, that is the diethylstilbestrol, synthetic estrogen, this will also show the same effect, fetal malformation. Argotamine, that is a migraine drug. And aspirin, NSAID, we all know that it will show fetal malformation. Next, we have birth. Premature birth or miscarriage is induced by argotamine. Delayed birth is induced by progesterone. Fetal difficulties is induced by aspirin. Lactation. Abnormal development of the offspring due to either direct exposure during pregnancy or via transfer of milk. Alcohol, antidepressant, and methyl mercury takes an active part in interfering this process. Next, we have the sexual maturation. Altered sperm maturation, colchicine, shows this effect. Lower sperm count, cyclophosphamide, shows this effect. Altered ovulation, testosterone, shows this effect. So these are basically the drugs that affects the various process of reproduction. We have come to the study design, that is about the reproductive toxicological study in female. The fertility, number one, is fertility and early embryonic development. It is also known as segment 1. And here rats are used. It will affect the phase of pre-mating to implantation. Next, we have the embryo fetal development. It is also known as segment 2. Rats and rabbits are used, and it will hamper the phase of organogenesis. Pre and postnatal development, segment 3. Rats are used, and it includes the phase of implantation to weaning. Here, number 1, fertility and early development study. Segment 1, it is also known as segment 1. These are the criteria, this whatever is mentioned in this slide, these are the criteria we have to follow during these studies. Here, usually this study is conducted in rats. May be done separately, male or female fertility assessment or together. That is, this study can be done separately, that is for male and for female, or it can be done together. It is also known as segment 1 study. It is multifaceted and very complex. Male and female gamete production and release is studied. Appropriate psychosexual behavior for mating is studied. Pre-implantation stages of the embryo are involved here, and implantation and viability of the resultant zygote. So this is the method. We have whatever we have seen in the earlier slide. This one is the criteria for the study, and this is the method of the study. The study method should be done in one rodent species. For some other studies, sometimes 2 species are used, but in this method, in this study, we can use only one rodent species. The drug should be administered to both male and female, beginning a significant number of days. It is 21 days in males and 14 days in females before mating. Drug treatment should continue during mating and subsequent during the gestation period. That is, the drug treatment should not be discontinued. It should be continued during the whole gestation period. 3 graded doses should be used. And the highest dose, that is the MTD, the maximum tolerated dose, should not affect general health of the parent animal. At least 15 males and 15 animals should be used per dose. Next, the control and the treated group should be of same size. The route of administration should be the same as intended for therapeutic drug. Here, I forgot to mention that those drugs we are using here, we can use those drugs that are mentioned in the earlier slides, the drugs I had mentioned before, that induces abnormality in different reproductive phases. For example, for pre-mating and conception phases, caffeine, alcohol, gospel, etc. can be used. And for organogenesis, heroin, caffeine, alcohol can be used to induce the toxicity. And then for implantation to weaning phase, aspirin, ergotamine can be used. Here, the route of administration should be same as intended for a therapeutic dose. The drugs that we will use here, their dose is same, will remain the same as that of the therapeutic dose. Next, the dam should be allowed to litter and the medication should be continued till the weaning of the pups. Here the dam means the pregnant and the parent female rats, and the pups means the infants. Also, the dam should be allowed to litter, and litter means the live birth of multiple offspring at a single time. So here it is mentioned that the dam should be allowed to litter and the medication should be continued till the weaning of the puppies. Observation on different factors should be taken into account. Here, observation on the body weight, food intake, clinical signs of intoxication, mating behavior, progress of gestation, pasteurization period, length of gestation, pasteurization, that means the delivery or the labor, postpartum health, that means the health after the delivery of the baby, the gross pathology, and the histopathology of the affected organ. If any organ is affected due to the drugs given for the induction of toxicity, the histopathological study should be done, and of the dams, that is of the parent female, should be recorded. The pups for both treated and control groups should be observed for general signs of intoxication, sex-wise distribution in different treatment groups, body weight, growth parameters, survival, gross examination, and autopsy. Also, the histopathology of the affected organ should be done. In case any organ is affected because of the drug that is given to induce reproductive toxicity, histopathology of that affected organ should be done. Next, we have the embryo fetal development. It is also known as segment 2 study. Usually, it is conducted in two species, that is rats and rabbits, also known as segment 2 study or the teratology study or the teratogenic study. Here, we have to use the correct species at the correct time and at the correct dose. These are the criteria. These above mentioned are the criteria. Next, we have the method. Dosing is done from the 6 to the 18 day of the gestation period, that is the blastocyte implantation period to the closure of the hard pellet period. Next, it should be done in rats and rabbits, and these rats and rabbits should be grouped into 4, and 20 to 16 liters should be collected. These are the evaluation studies that should be taken into account. It is the end point in an embryo fetal development study. DAMS, that is the female pregnant rats, and the fetus, that is the infants or the babies or the pups. So in DAMS, clinical observations should be taken into account. The weight gain and food consumption of the dam of the parent female, number of implants and fetus, and post-implant loss, if there is any. Coming to the fetus, that is the pups, fetal and placental weight should be taken into account. External abnormalities, soft tissue abnormalities, if there is any, skeletal abnormalities should be taken into account. Also, the death of the pups, if there is any, and the retarded development and growth should be recorded. Next, this is the last test, that is the pre and the postnatal development. It is also known as segment 3, and here usually rats are used. The prenatal and the postnatal means the prenatal development is the development of the embryo during gestation, and postnatal development is a development of the infant after birth. Here, in this study, especially recorded if the drug to be given is given to the pregnant or nourishing mothers for long period, or they are indications of possible adverse effect on fetal development. That is, this study is only recommended if the drug is given to a pregnant or nursing mother. The drug, that is the reproductive toxicity inducing drug, is given to a pregnant mother or a nourishing mother for a long period of time. Here, one rodent species is used and rats are preferable. Dosing at level comparable to multiple human doses should be done by the intended route of administration. That is, whatever the effect is seen by the drug as a therapeutic effect, that route should be taken into account. At least 4 groups should be there, including the control group, and each group should contain 15 dams. That is, 15 female rats, pregnant female rats should be there in each group among the 4 groups. The drug should be administered throughout the last trimester of the pregnancy from the 15th day of the gestation period, and then the dose that causes low fetal loss should be continued throughout the lactation and weaning period. The dams should then be sacrificed and examined as described below. That is, after the study, after the stoppage of the gestation period, the dam should be sacrificed. The female pregnant rats should be sacrificed, and the following should be studied. 1 male and 1 female from each litter of the F1 generation. That is the fetal generation, the fetus that is produced from the parent animal. From there, 1 male and 1 female should be taken. Total 15 males and 15 females in each group should be selected at weaning and treated with vehicles or test drug at the dose level that we have described above in the previous slide. Throughout the period of growth to sexual maturity, pairing, gestation, parturition, and lactation. Here we are talking about the infant, the pups that are produced from the male and the female. So here we are going to select 15 males and 15 females, and they are being treated with vehicle or the test substance throughout their life, that is till lactation period. The mating performance and fertility of the F1 generation should thus be evaluated to obtain the F2 generation, whose growth parameters should be monitored till weaning. Next is the mating performance. The mating performance and fertility of the F1 generation. The infants that were produced from the parent generation, the mating performance should be studied. And then F2 generation is allowed to grow to evaluate their parameters, that is to evaluate their growth and development parameters, and it is evaluated until the weaning period. The criteria for evaluation should be as the same we have described earlier in the other tests. The parameters are: the animal should be sacrificed at the end of the study, and the observation parameters should be studied. This includes the dams, that is the female rats, pregnant female rat. Their body weight should be taken into account, food intake, general signs of intoxication if any toxicity is happening in the body, progression of gestation if any delay or upgrowth of any gestation period is there, parturition period, that is the delivery period, and gross pathology if any is there, then this should be conducted in case of dams. And in case of pups, that is the infants, the clinical signs, sex-wise distribution in the dose group, body weight, growth parameter, whether proper growth is there or not, gross examination, survival rate, and autopsy should be studied. And if necessary, the histopathology should also be studied. So here we have come to the end of today's discussion. Thank you so much for your patience. Have a nice day.